Hello and welcome. This is TVC News at 10. The federal government is worried that Nigeria may experience the devastating effects of the COVID-19 pandemic seen in India. Minister of Health Osage Hanire says the spike in coronavirus cases is raising concerns because the country's demographics are quite similar to that of India. For the World Health Organization, it's a worry scenario as almost 70% of African countries are lagging behind on vaccinations as infections on the continent rose by 18% within the last week alone. This formed part of discussions at the virtual update meeting by the World Health Organization and health ministers of Nigeria and Mauritania. Kemi Balogun reports.
The ravaging third wave, rise in COVID-19 infections, vaccine arrivals and its local production are all on the front burner of discussions at this virtual meeting. The highly transmissible Delta variant has been found in 26 African countries, while the Alpha and Beta variants have been detected in 38 and 35 countries. Nigeria has in the past week continued to record cases of COVID-19 amid fears that the Delta variant could be fueling these new cases after it was first detected about 2 weeks ago.
I've begun to see a gradual increase in the number of cases. We worry a lot about that because our demographics are similar to India, and we have instituted various alert mechanisms. First, new prioritization of areas with high prevalence.
The global health body says Africa seems to be at the crossroads in the past 8 weeks with rising infections and the surge, and it calls for increased surveillance and detection, especially with the arrival of vaccines across Africa within the coming weeks.
The Eid celebrations, which we mark this week, may also result in a rise in cases. We must step up surveillance and be prepared. We must all double down on prevention measures to build on these fragile gains. And countries must prepare for an increase in cases, especially severe illness, and what needs to be done to limit people dying.
Only about 3.5 million to 4 million doses of vaccines are administered weekly on the continent. But to meet the September target, this must rise to 21 million doses at the very least each week. Health leaders call for better preparation and logistics to help gain more ground on this.
And I'm very pleased that our member states have responded and are sharpening their preparedness and actually looking to learn from the first round of doses that they administered to see in each country what were some of the challenges they faced and what do they need to get better prepared.
I wish to appreciate the recent attention to vaccine distribution, especially from the COVAX facility, the Harvard facility, and also the bilaterals with the United States government, the UK and others, and urge high-income countries to do more to support low- and middle-income countries.
African countries have been advised to urgently ramp up COVID-19 vaccination logistics and make preparations, including increasing vaccine rollout campaign messaging ahead of vaccine arrivals within the next couple of weeks. Kemi Balogun, TVC News, Abuja.